so much. I've heard a lot of great stuff from our first two presenters, so I've got big shoes to fill. Benefit Focus is a platform. We're kind of the Amazon of healthcare benefits. So today we'll talk about platforms, apps, and consumer engagement. First, a little bit about who we are. We'll go through this really fast, then we'll move into the cool stuff. Here's who we are. We founded in 2000, about 700 associates. We're based out of Charleston, South Carolina. We have cloud-based technology for consumers. We're primarily focused on the employer market and insurance carriers. So we have 15 million consumers on the platform as of a week or two ago. About 300,000 employers use the platform. 30 out of 32 Blue Cross Blue Shields. We've had tremendous growth throughout the years. Go through this pretty quickly. We have a lot of insurance clients from Aetna to Care First. Most people get their health care delivered to them through their employer in the United States. Or if you're buying individually, you probably have seen some of our private label products through the insurance carriers. Lots of large employers, all of them trying to lower the healthcare cost trend, figuring out ways to do that. We span the gamut of employers, whether they're small, medium, large, every kind of industry. And the interesting thing about that is a lot of people talk about technology and say, well, not everybody has access to a web browser. Our folks are butchers, our folks are grocers, things like that. We have fantastic, fabulous success with folks that are in what you might call blue or gray collar occupations. The platform covers hundreds of different types of benefits, and we're really prepared to move towards what some folks would call a defined contribution model. So at some point in the future, there are folks that say, it's probably going to end up covering healthcare like pensions. So in 1980, you put money towards your pension and you got a defined benefit coming out of it at the end of the year, or at the end of your lifetime when you're retired. Healthcare is moving the same way, that the employers want to give, here's $5,000, spend it any way you want. We don't care if you have a domestic partner, if you have a dog, if you have a family, things like that. Spend it any way you want to. We'll provide a platform for you to shop and buy whatever you want to do. So we're already there, 3 minutes. Great. So get to the good stuff. The Benefit Focus platform is the one time that most people think about, what am I going to do for my healthcare? So people spend 2.5 hours figuring out what kind of smartphone they're going to buy, and about 6 minutes saying, I'm going to do the same thing I did last year, check the box, boom, I'm done. Then they wonder why the costs are what they are. So the platform uses social media to engage people and go grab you by the lapels and say, what are you doing? So we're trying to get people to focus on their health and get the connection between the deduction that comes out of your paycheck and how you spend those dollars. So we're using a whole host of social media tools like Twitter, YouTube, MyPlate.gov to grab people and get them to think about what they're doing and come back to this portal. The reason people come back to Facebook every day, and they've got 700 million users, because it's constantly changing. So we're building a platform so that the employer can decide what's important to them and what they're trying to do. 2 minutes. Next slide. The employer manages the platform. It's as easy as Facebook to make those changes, to add in the feeds, build in your RSS feeds, build in your New York Times Health feed, build in your MyPlate feed, whatever you want to build in, and it's constantly updated and changed by third parties. So the second component of that is we love apps. So apps give you the ability to take the data, your claims data, your health data, pull that back into the platform and present that to you so that you can make smart consumer decisions about things like, should I be in this plan, that plan, or the other plan? Well, I don't know what plan I should be in until I know how much money did I spend last year. How do you get that information? Pull it all down from the carriers to present it to you. 1 minute left. So a lot of the other apps that we deliver that are pretty cool and probably more relevant to this app audience, claims analytics. What are you as an employer spending your dollars on? What are the top 5 categories of spend? And how can you start impacting the employers and employees' lifestyle choices to lower that long-term cost trend? Second component is just-in-time wellness. Just-in-time wellness looks at that same kind of information and says, what's happening to this person? And alert them via smartphone, by text, what have you, saying, wrap it up. But it's looking for somebody that's got blood sugar values of X and hasn't been to the doctor and hasn't had their foot exam, hasn't had their eye exam, isn't taking their maintenance medications, and notifying the employee, hey, you need to do something. Go back into the portal and we'll provide you with health education so that you can take action to have a better, healthier lifestyle. Thank you very much.